Good afternoon, everyone. Welcome to the Extra Mile Show. I'm Jody Harris, sitting in for Linda Boudreau. Thank you for joining us. Today we have a special guest, Dr. Jerrilynn Primeaux, who is a doctor of chiropractic. So from my understanding, welcome, first of all.
Thank you, Jody, for having me. I appreciate it.
Thank you for coming. My understanding of chiropractic medicine is that it's an alternative medicine that deals with the musculoskeletal system. So tell me a little bit, and that's all I know. so tell me a little bit more about.
Chiropractic is a form of alternative treatment, so it's not like traditional medicine. We don't utilize surgery, we don't utilize medications. It's all natural. There's a common misconception with chiropractic. A lot of people think it's about cracking bones, and that's really not what we're all about. It's all about the whole body wellness, from exercise to nutrition, to just eating right in general and making sure your body stays healthy. That's what chiropractic is about. Like
so
I said,
a lot of prevention.
A lot of prevention, yeah. It's so much easier to prevent than it is to treat.
Okay.
So it's a lot cheaper also in the long run. I mean, we don't utilize medications, and medications nowadays are so expensive.
Mm-hmm.
Yeah.
See, because my thought was that you had to be in pain to go see a chiropractor. Is that a misconception?
Not necessarily.
Okay.
Yeah. I mean, it's good to stay, make sure your bones are healthy and your spine is moving right, and that's really the basis of what chiropractic is to make sure the spinal, the vertebrae are moving right. It's motion is lotion, so if you keep your body moving, you prevent arthritis. So when the body doesn't get adjusted like it should, over time arthritis will set in. It's kind of like the sedentary lifestyle. If you just sit all day, your body just withers away, and it's best to keep moving. Also utilize exercise too. That's another good form of preventative treatment.
So how do you know if your body is not in alignment? Are there symptoms that would lead me to go see a chiropractor?
Not necessarily. Okay. Most people notice, I mean, you may have some symptoms. People notice that their posture is not right. If they have like the rounded shoulders or the forward head carriage, that's definitely a sign that your body is not in correct alignment. As we see with the vertebra here, the proper position that the neck should be in this position here, and then the thoracic slightly curved, and then the lumbar spine also slightly curved.
Okay.
When there's too much curvature, that puts joints in the facet. I mean, it puts pressure in the facet joints of the lower back, causing lower back pain and so on. Say you have the forward head carriage, you know, the forward slope shoulders, the cervical spine will get compressed too. So
if someone presents with these type of symptoms and they come to you, what do you do for them?
Well, we do a full workup: neurological, orthopedic, and physical exam. We do blood pressure, temperature, check heart rate, and then we weigh and measure. We also will do body fat percentage if needed. If the patient seems like they should get on an exercise program, we'll do that too. Also neurological tests, which involve reflexes, sensory and motor tests. We also utilize orthopedic tests. So if somebody comes in for a lower back injury, we'll do lower back orthopedic workup. Also neck. We treat shoulders, elbows, wrists, knees, ankles. If there's a joint in a muscle, we can treat it.
So from head to toe, you
head
treat.
To toe.
And when you say treatment, like explain to me what a common treatment is.
Well, I mean, every patient is different, so it's hard to, it really just depends on what that patient has. Once we diagnose that patient's condition, we'll do a workup on that condition. So say it's just generalized lower back pain. if it's an acute injury, if it just happened, like say somebody slipped and fell yesterday and they came into my office today, I would most likely do either some electrical stimulation or ultrasound because they're most likely inflamed. We wouldn't do heat because that's more for chronic injuries. When you just have an injury, you want to do ice because of the inflammation process.
And you do ice within what time
Within
period?
about 3 days. Anytime after 3 days, the inflammation stage is usually in the second phase of healing.
So then you move from ice to heat, or is that not necessarily?
Heat after a few weeks.
Okay.
Yeah. We'll also do chiropractic adjustments. The adjustment is just utilizing our hands or a specialized instrument to restore motion to the spine. And you'll just hear like the little pop. That's why people think we're cracking bones, but it's not really cracking. It's just the release of gas bubbles in the spine.
Like, show me on here. When you hear that pop, what are you doing?
Okay, let's see. Say we're adjusting the mid back here.
Okay.
Okay. It's gonna basically open up this facet joint here. It's going to go in and out, so it's going to realign that spine, and it's also going to restore motion, bringing fluid back to the area, nutrients, and so on, so that the spine moves right. If it's stuck in one position, that's not a good thing. So we apply an adjustment to restore motion back to that spine.
And can you actually feel when it goes to where it needs to
Yeah,
go?
yeah,
Okay.
you can feel it. And most people notice increased range of motion, like if their neck is stuck in this position here and we give them an adjustment, they'll be able to go even further.
Immediately.
Yes.
Amazing.
Yeah.
So you relieve a lot of pain, I'm sure.
Yeah, that's most people come in because they're in pain and they
Right.
want to get out of it fast. So
And they walk out with less pain. Does it ever prevent surgery?
yes,
at
it
times?
does, especially for lower back injuries. Say there's a disc problem here at L4, L5. We do lumbar traction therapy, which opens up the lumbar spine, so it's going to extend it out this way.
Okay.
Moving that disc back into the space that it needs to be. So let me show you on this one here. This is a typical presentation of L4, L5 disc bulge. So what the traction will do is open up these disc spaces here and move this disc back to the space that it should be in.
Okay.
So.
Well, great. So I understand that you do some special techniques.
Yes, I do a specialized muscle technique, and it's called gua sha muscle therapy, utilizing tools.
Okay.
These are the type of tools we use. There's some more on the table here. This is mainly for patients with chronic muscle pain, fibromyalgia, even just knots in general, people that work at the computer all day, even people who use poor posture, and so on. So if you find a little knot in your muscles and this is giving you pain, well, this treatment is what's going to help that. We apply lotion to the area, and we utilize the tools to break up the knot. And knots are made out of scar tissue adhesions. So whenever there's a trauma in the body, or even if somebody just uses poor posture, like I said, the scar tissue will build up in the area to support it because it thinks it's in trauma. So over time, if you don't get the scar tissue corrected, it's going to build up on top of each other, forming a huge knot or multiple knots. So that's what this
And these
technique
tools
breaks it up.
work those knots out.
Yeah, scar tissue builds up in cross sections, so it's not flat. Builds up like this, and then over time just builds up on top of each other. So we use the tools and go above the area and just work the knot out. And most patients notice an increased range of motion after the first treatment. It usually only takes about 6 to 8 treatments depending on the severity of the condition, either once or twice a week for 4 to 6 weeks. And then we'll put the patient on a rehab program because they probably got this because, I keep going back to the posture issue. They probably got it because they sit at the computer all day and they have the rounded shoulders. So from there we'll move into an exercise program to help them strengthen the back muscles, pulling the shoulders back, bringing the head forward, and helping to prevent this injury from coming back. Like I said, we're all about prevention. So much easier to prevent than to treat.
So that's the common course of treatment for the average person that would come in with some ailment, 6 to 8 weeks?
Yeah, I mean,
Or 6 to 8
everybody's
treatments, rather.
different. It
Okay.
really just depends,
Depends
on
on
how long they've had that problem. Because most likely it didn't get there overnight, so it's
Right.
not going to get better overnight. And it's all about the patient also has to be proactive in their healthcare too.
Mm-hmm.
You know, when we teach the patients proper stretches or drink more water, stay away from smoking, if they don't follow these instructions, that's even longer that it's going to take for them to get better.
And it more likely to reoccur, I would imagine.
More than
if
likely,
they continue
yeah.
those things. So tell me a little bit about the training that you had to go through. You know, what is the curriculum that a
chiropractic school is very similar to med school. However, we don't have a big emphasis on the medication and the surgery side. It takes 4 years undergraduate degree, a bachelor's degree from university,
Mm-hmm.
and then from there we go to specialized chiropractic school for another 4 years. The curriculum involves courses in anatomy, physiology, dermatology, geriatrics, pediatrics.
So you treat from
pharmacology.
babies to, I mean, you could treat any age.
Any age group.
Okay.
Mhm.
Well, tell me about the most common thing that you see. Is it back pain, as you mentioned, or?
Since I have this special gua sha technique, since I advertise that a lot, I see a lot of muscle tension, chronic muscle pain, and fibromyalgia.
Mm-hmm.
I also see a lot of sports injuries too, certified in sports rehab, so we see that a lot. And also lower back pain is pretty common too, because there's a lot of people that do manual labor work around here in South Louisiana. Also a lot of people that sit at a desk all day. So.
And then you teach them proper ways to not, you know, if they're doing manual labor, proper ways that they might prevent this injury from happening
proper
again.
Body mechanics. Yeah, it's all about lifting the right way, because that's the easiest way to hurt yourself, is using poor lifting techniques. You always want to bend at your knees, don't bend at the waist, hold things close to you, don't hold it out like this.
So if I woke up one morning and I had a lower back pain, would I need to get a referral to come see you, or?
No, chiropractors are portal of entry professionals, meaning we're doctors and we're certified. You can just call us up, make an appointment, and you can see us. There's no need for an MD referral.
Okay.
However, we do cross-refer if we need to.
Right.
We work well with the medical community, trying to get the patient well.
Okay.
Yeah.
And would my insurance cover it?
Yes.
Okay, depending
insurance,
upon.
Yeah, insurance is covered.
Okay. Well, that's good to know.
And they even cover the muscle technique that I do. So and
the
that
specialized
helps.
technique. Okay.
Yeah, because they don't cover massage therapy, but if we code it as the muscle treatment, it definitely is covered.
Now, do you get referrals like from, you know, say someone goes to get frequent massages and they just are constantly having knots? Would that be a proper referral for that?
That would be an excellent referral, because
Okay.
massage therapists are very natural based. We work very well interchangeably with the massage therapist.
Okay.
Even though this is a form of massage therapy, we still cross-refer.
Okay. So you can refer to them, they can refer to you.
Mm-hmm.
Okay. Well, you mentioned some different stretching techniques, and before the show ends today, I'd like to get to some of those. But what are some things, some wellness or some basic tips that you commonly tell people or share people?
Oh, definitely. If you're not exercising, you need to start exercising now. Research has shown that is the #1 way to prevent any type of disease. It doesn't matter what kind of disease it is, that's the #1 way to prevent it. The ACSM now recommends 5 times a week for 30 minutes of exercise. This can be done throughout the day. You don't have to come to the gym and do 30 minutes of treadmill. Even just if you're at work walking up and down the stairs, that even counts towards your 30 minutes.
So it doesn't have to be 30 minutes in a row.
No,
it could be
spread out throughout the day. Also, drink more water. Stay away from the Cokes, coffee, the caffeinated drinks. Those are definitely not good for you.
We hear that every day, all day. What does that do for the body?
Well, I mean, the acidic content in there, it wears the bones down.
Of the carbonated drinks?
Mm-hmm.
Okay.
Yeah, in the carbonated drinks. With the caffeine, I think it's been shown to deplete the body of calcium also. So.
Okay. And water. replenishes?
Water, it brings fluid back to the cells, and it replenishes the body, rids the body of toxins, and so on.
And I would imagine a healthy diet would go hand in hand
Oh,
with all of that.
Yeah. Yeah, you can't come to the gym and then go eat at McDonald's right after. It's
Right.
kind of defeating the purpose.
Right.
So,
Okay, well, what else would you like to share with the general public today? Just some general things about chiropractic, maybe some common misconceptions or, you know.
like I said, whenever we first started, most people think we're all about cracking bones, and it's really not about that. We're all about preventing.
Just
That's about it.
right.
Prevention.
And treating the whole body, which I didn't really have a full understanding of, because that makes sense. And then preventing that injury from happening
From
again.
recurring.
So there's a lot of education,
Yeah.
a big educational component
Yeah,
of it as well.
and the medical community is not too. It's unfortunately they don't educate the patients like they should. It's like give a pill and it's going to get better, but a lot of times medication will cover up the problem and doesn't get down to what's causing the problem. It usually treats the symptoms and not the root cause of it.
Right. And
So,
you
that's what
treat the
chiropractic
root
is.
cause.
Yeah.
Okay.
Symptoms too, because most people come in with pain, but we get down to what's causing that person from having this lower back pain.
Now, you mentioned earlier about fibromyalgia, and I know there's a high incidence of that, and we've heard about it over the last few years so much. So what do you do for that? Or
Well,
what are I know it's fatigue.
It's generalized muscle pain. It's different areas of the body that even if you just touch it, they scrunch in pain because the nerves get so inflamed.
Okay.
A lot of times it's due to the scar tissue buildup in the muscles causing the knots too. We utilize the gua sha technique to treat the fibromyalgia.
Okay.
So working with the MDs too, because it's also somewhat of a nerve component that a lot of times medications will help
that
treat
as well.
that.
And is that an ongoing treatment more so than being that's a condition that doesn't go away? Or does it have flare-ups? Or
Yeah, patients will have flare-ups, and then some days will be good. So they usually require more intensive treatment.
Okay. So in terms of like preventative stuff, you mentioned the exercise, healthy diet, of course. You also mentioned some stretching techniques. Are there some things that you could show us today that
yeah, I can show you. I want to show you on. Let's see this one. Let me see the other board there. Actually, let me see this on here. Okay. Okay, this is a picture of the sciatic nerve. That is probably one of the most common conditions that people think they have, although it might not be true sciatica. Well, let me show you on this picture here. You can see the sciatic nerve here. Now, when we go to this, here. Sciatic nerve also comes from L5 in the pelvic area. Well, a lot of times this is not due to, it could be due to a disc bulge, but sometimes it's due to tight muscles in the buttock area, particularly the piriformis muscle. And it's a muscle that runs parallel to the floor, right on top of the sciatic nerve, right in the pelvis, right underneath the glute max and the glute medius muscle. Okay. So there is a stretch that we can do to stretch out the piriformis, so it's going to relieve pressure off of this sciatic nerve.
So it works that muscle.
Yeah, because sometimes sciatica is due to the tight piriformis lying right butt up against that sciatic nerve. Okay. So if you relieve pressure off of that, then people notice decreased numbness and tingling and so on. Sometimes it could be due to the L5 vertebra, the disc bulge, but using an MRI would really tell us what's really going on. So if it's not due to a disc bulge, it's probably due to tight piriformis. Okay. And the stretch that we can do for this, let's see if I can do it.
Make sure we can see.
Okay, not sure if you can see, but you basically just sit up in a chair and cross one leg over the other, just like you're doing like a figure four seat here. Okay. And you sit up straight and you lean forward at the waist. Okay. And as soon as you do that, you'll notice.
And that's stretching that muscle.
Stretching that hip in the piriformis muscle.
Okay.
And you want to hold that between 10 and 15 seconds. And then you switch to the other side, sit up straight, and lean forward at the waist.
Okay.
And hold it there.
And how many times do you want to do that?
I usually recommend patients, you can just do it once each side, every hour on the hour. Just keep it stretched.
Because as long as that muscle's loose, or loose, you know, not contracted, I would imagine, it's relieving pressure.
Pressure over the sciatic.
Okay. So what are some other exercises?
Well, tight hamstrings are due to, there's been a correlation of tight hamstrings and lower back injuries because everything is connected. You have your calf muscles here, hamstrings connects to the glute, and so on. So if you keep this stretched, it's going to relieve pressure off of this lower back. You can just sit on the floor and do a toe touch. You can even stand and touch the floor. That'll stretch the hamstrings out real good too.
So I would imagine, since you recommend stretching, that stretching is a big component of exercise because you don't want to, you know, start this healthy lifestyle and get into exercise and not stretch properly. And then,
well, if you are doing an exercise regimen, you need to first do a 5-minute warm-up. You don't want to just stretch, come in the gym, stretch a cold muscle because that's the easiest way to tear fibers.
Okay.
So do a 5-minute warm-up, treadmill, elliptical, bike, whichever you choose. Stretch really good because the muscles are good and loose and warmed up, and then go into your workout, whether it be resistance training or cardiovascular training.
Now, is it proper to stretch after as well?
Also, whenever you're done with your workout, do a 5-minute cool down and then stretch before you leave.
Okay.
Yeah.
And that just keeps everything
loose.
Loose.
Yep. All
and
about
loose
prevention.
is good. Okay. Any other specific stretches that you recommend?
For particularly patients that play tennis or even golf, we'll have tendonitis in the elbows. There's a good stretch you can do, or even for carpal tunnel syndrome in this area here. This stretch here for golfer's elbow or carpal tunnel, you just hold it out here. And then for tennis elbow, which is on the lateral epicondyle, you bring your hand in like this. Do you want to try those for me?
I can. Okay. Tell me how to do it
like
again.
Like this? And pull. And you should feel it right in here, and then also in the carpal tunnel area.
And what was the other one? To turn?
Turn this way, and then you push. You should feel it right in that.
Right here. Okay. Yeah, that's common now too. You hear a lot about that. So if you can prevent that, that might prevent carpal tunnel surgery?
Oh, definitely.
Okay.
Definitely. Yeah.
And you would do those.
It depends on the severity of the condition.
But you would do those exercises just like the other ones on the hour,
That's what I usually recommend. Just as often as you can think of, stretch. I mean, stretching is not gonna hurt you.
You can't stretch too much.
No.
Okay. So those are the most common stretches.
Also, we can do some neck stretches. You want to do these with me too?
Okay.
Okay. You bend your neck. Well, first, feet flat on the floor. Okay. All right. Bend your neck to the side. Put your hand on the side of your head, and you pull down. This is a good stretch for the side of the neck and also the trapezius muscle.
I feel it right here.
And then you do the other side here. And pull down. Okay, for the back of the neck, you go down at an angle on both sides.
And you feel that right here. Okay.
Yeah, in the back of the neck. This is a good headache stretch. A lot of people have headaches and they think it's a true migraine, but a lot of times it's a cervicogenic headache caused by the nerves in the upper cervical spine. You have small little muscles that go from C1 to the base of the skull called the suboccipital muscles, and when these become tight, it's going to compress on nerves that wrap to the top of the head. So this is a true classic cervicogenic headache, when it wraps and then goes around.
So you would do that exercise during the headache, or when you at the onset, or
both? And
it relieves the pain.
And relieve it, as well as icing the back of the neck and just massaging the temples. That helps too.
Okay, and that's when you feel a headache all around. Okay, so we have just a couple minutes left. Is there anything that we didn't cover today that you want to, say about what you do or how it fits into exercise or wellness or?
Yeah, like I said, I mean, it's all related. It's all about prevention. If you start exercising, you'll notice a difference, and your cholesterol will most likely go down, blood pressure problems, diabetes, that even helps with that. It's going to definitely bring the blood sugar down. It won't get rid of the diabetes, but it'll definitely help. And any kind of ailment that you have, you'll just notice. I mean, motion is lotion. When you keep moving, that's the best way.
That's your slogan, huh? Motion is lotion. Just so stretch and eat right, exercise. And
it's easier said than done. It's just
because we hear that every day. Eat right, exercise.
Yeah, it's easy to say it, but you have to actually do it. You have to practice what you preach.
Right.
So.
Okay, well, we appreciate you coming today. You sure have cleared up a lot of things for me. I know I didn't really understand exactly everything that you do. Excuse me. So I appreciate you coming. I appreciate you being a guest.
Thanks for having me.
Appreciate everybody tuning in today. Thank you for joining us for the Extra Mile Show. We appreciate your time.